Mrs. Reyes is a 60-year-old female as admitted to a palliative care unit in their hospital. She needs special assistance and she needs to be monitored. Recently, she was diagnosed with a stage 4 breast cancer and has already metastasized up to her bones. Mrs. Reyes appears to be weak and thin and also look pale and dry. She complains about her difficulty in breathing. Some skin has changed and feeling of discomfort and pain in her breast. She also experiencing back pain, weakening of her bones, numbness in her legs and arms. Due to her condition, she was forced to limit her physical activity and also her usual routines were affected. Mrs. Reyes is now widowed. She lives alone in her Nipa house with her dog, who she considers as her only family left. Her children are already grown up and have their own life. It has been years since she last saw her children, but now Mrs. Reyes is just enjoying her own company. After a month of admission, she became sad and depressed because she misses the old life that she used to. Mrs. Reyes is progressing quickly in the course of the disease. She is no longer able to do any of her activities of daily living and is unable to feed herself. She has lost a significant amount of weight and her disease worsened. She became incompetent to make her own decisions. Her family wants a DNR. They don't want any heroic or extraordinary measures. They are only requesting comfort measures at her end of life. Hi, good morning. I'm Rain. I'm your nurse for today.
Hi, good morning too.
Could you please tell me your name?
My name is Salvacion Reyes.
I'm going to do an assessment as part of my daily routine and to know your condition. Is that okay?
Sure, no problem.
I took your vital signs. All are in normal range except your oxygen saturation. So let me put back your oxygen and put your bed to semi-Fowler's position so you can breathe better. When I did the physical assessment, your abdomen is distended and rigid. Your spine and hip are tender upon palpation. I noticed that the urine output is slow and with moderate amount of blood. You look pale, weak, and low energy. Is there something bothering you?
Nothing.
It seems to like you are upset and lack energy. I am your nurse. I'm willing to listen and I care for you.
I'm a bit sad.
Can you tell me about your feelings?
I think nobody loves me. I miss my family, my pet. They are my source of strength. They rarely visit me. I don't have a purpose in life anymore.
Your family loves you. Maybe they were just busy. That's why they couldn't visit you. Do you want me to call them? At least to lessen your sadness. I know that family comes first, and your family loves you.
Okay. That would be a nice idea. I want to talk to them, please.
Okay, I will call them. So how did it went, Mrs. Reyes?
I feel so happy seeing them have a successful life. I feel at ease now and happy. I can now have a peaceful rest. Thank you, nurse.
You're welcome.
The first part of the nursing process is the assessment or discussion. In the assessment phase of the nurse process, the nurse systematically considers behaviors manifested from the four adaptive modes and assess the stimuli for those behaviors, categorizing them as focal, contextual, or residual stimuli. In addition, the nurse identifies the stimulus of the adaptation level that is integrated, compensatory, and compromised life processes that affects the adaptive or ineffective behavior.
Planning. The nurse and the patient set goals to promote adaptation. It should involve the statement of behavioral outcomes of nursing care that will promote adaptation. The goal statement should designate not only the behavior to observe, but how the behavior will change.
Number 3. Implementation. The nurse decided how to best help the patient achieving his objectives and selecting treatments to facilitate the desired adaptation by changing stimuli or increasing the adaptive process. Also, the nursing intervention in this space includes the selection of which stimuli change. Number 4, of course, evaluation. This focuses on determining if the adaptive goals have been fulfilled, as well as judging the effectiveness of the nursing intervention to the behavior in relation of the individual or group.